just kick us off with a couple quick comments. So first off, we're going to talk a little bit about, we're going to talk a lot about this project we completed in Northeast Indiana, Child Care Mapping and Dashboard Project. And I've put a link in the chat for everybody so you can kind of see what we're talking about. So that's really going to be the topic. And I want to thank everybody for taking the time to join us today. It's our Smart Take series. We're going to be quick. It can be done in a half hour here. So we've got some rapid fire questions, but let me just kind of start with introductions here. I'm Brian Nottingham, Vice President, Research Evaluation Community Impact at TPMA. And I'm joined by my esteemed colleagues today, Alex Taylor, who is a consultant at TPMA as well, and then Ashley Sharpley, also a consultant at TPMA. They've worked really, really closely on this project. I think they did really a great job. We're extremely proud of it. So my goal today is to do not much talking and to ask them questions and let them sort of share with everybody how it took shape and how we go from there. So in the interest of keeping it moving, I'm going to start this off with a question for Alex. Alex, can you talk us through in broad terms about our work with Northeast Indiana, the Child Care Coalition, and what kind of brought us to this point?
Sure. Thanks, Brian. So really our work with the Northeast region of the state started with our first work willing analysis. This is what we're calling our phase one. I believe this happened in 2019, and Brian, correct me if that's incorrect. That was our first shot for this kind of program. We developed our work willing analysis as a result of that. Since that point, we have completed phase 2 and phase 3 studies with the Northeast Indiana region. It included the development of different kinds of strategies and models, including the development of a centralized coalition and the development of an interactive data map and dashboard, which we're here to talk about today. Now, the latest phase, the data map and dashboard, the main goals were really to understand and highlight the areas of greatest need of childcare within the 9-county region. Our team emphasized visual understanding and readiness specifically for investment purposes, specifically marrying childcare data with employment and housing data to complement those kinds of variables.
That's great. That's great. Thanks. Thank you, Alex. Appreciate that broad overview and sort of our background. So Ashley did she did all of the GIS mapping and created the dashboard itself. So I'm going to ask you, Ashley, if you could talk to us a little bit about some of the challenges with this project in terms of data aggregation, the updating, and the visualization components.
Yeah, absolutely. So I think something we're all fairly aware of and kind of the baseline challenge to this project and data in general is that childcare data hasn't been a priority for a lot of the programs and systems that we normally go to for data collection and aggregation. So it was a lot of pulling from different sources and filling in the gaps with either like logical moves or disaggregating to levels that, the data doesn't always come in. And to your point, the consistency of childcare related data is not always what we would like it to be. So we sometimes have to work with out of date data, or we have to go kind of find things independently. Part of that's just a capacity issue. A lot of the times it's not big national organizations that are developing childcare data on a local level. It's just up to that locality, or sometimes the state, and they don't always have the capacity to keep that updated year to year, or let alone month to month. So it was a kind of puzzle process, and we also thought about how if we can't get the exact data or statistic that we're looking for, we start looking for areas that can stand in for that. So like if one thing doesn't work exactly, like is there another data point that can tell us a similar story? Because at the end of the day, right, we're trying to create a cohesive story about childcare in this region, as opposed to just a big list of numbers.
No, that's great. That's very insightful too. And really thinking about, I guess, telling the story that we're trying to convey here. Alex, maybe we should have started here, but we talk a lot about the accuracy and the validation and the data components that were sort of drawn into it. And there's a lot there, and I would like you to comment on some of those data sources. But before you get to that, Alex, can you tell us a little bit about what was the goal here? What's the story we were trying to tell?
So really the ultimate bottom line is, where is our childcare? They want the client, Northeast Indiana, the region, they wanted to know where their stock currently was at, where is their inventory, and where is that inventory? Then they also wanted to compare that inventory to economic development. And in economic development, we pulled traditional variables such as employment, we looked at jobs, we looked at things like housing and permits, as well as other variables of interest with the group. But truly the main priority was, let's take stock of our childcare, and then let's juxtapose that to economic development so that investors, developers, anyone of that variety can take a brief look at this and get an idea of where to invest and how much to invest.
No, that's great. It's great. Alex, can you talk a little bit more, I guess, about some of the data points that were included here? That would be great.
Yeah, so our process on the data team was to first start by analyzing the pool of data to figure out the standardization. Ashley kind of alluded to it. We had to sometimes take macro data, make it micro, vice versa. We kind of juggled things around, moved things. More importantly, the first idea we had is we first had to disaggregate based on census tract, right? So we chose those variables that weren't county level, and we disaggregated those out. And we chose two different data sets to use as our basis. And the first was population, and we used that for the majority of the variables in order to disseminate them out. And then the second was the number of children. Our work willing analysis includes a data point of number of children. So we specifically pulled that in order to highlight that as well. In terms of data, we covered probably 20 to 45 different variables when we're really getting to the bottom of the barrel. I think we pulled jobs on 2-digit NAICS codes. We pulled variables of different types of housing units. We pulled the number of housing units versus renters, but we also looked at different things such as individuals who are experiencing low income, or people who have supplemental assistance such as TANF or HIP or programs of those varieties. So it was kind of a group effort on everything. We kind of pulled everything, but primarily what we wanted to focus on was that childcare program variable, and then make that story about the economic development.
Yeah, no, that's great, Alex. I love that. That's great. Actually, I would ask you, I guess, sort of the same question from the visual design, GIS mapping, dashboarding perspective. What was the story you were trying to tell, and how are you trying to convey that information in a useful way to the folks that are going to use it?
Yeah, I think that the most powerful way we did that, and I think we'll continue to talk about this, but is looking at the ratio of these kind of key metrics, right? I think one of the challenges we faced throughout is that, we pulled, I think Alex said, up to 45 different data points, but 45 different data points cannot go on one dashboard before it gets so confusing and, unusable. So working down to what those key elements were and how they can best be used and organized to tell a complete story that is comprehensible to not just people who work with data all the time, but people who might be completely, unaware of kind of how these metrics work. But as I said, I think the most powerful tool that we used were these ratios. So we looked at, from a number of different metrics, how many, for example, children in need of childcare there are in a region per childcare program, right? And we did the same thing for employment. We did the same thing for low income families, and we did the same thing for housing. There's kind of like each of the sections of the dashboard are centered around one of those ratios. And so I don't keep talking about this, but we looked at that kind of a scale, right? Where a lot of again, we're looking at by census tract level, a lot of those census tracts don't have any childcare programs. And so highlighting those and then kind of seeing the range of, is there adequate childcare already in the census tract, all the way down to we have thousands of kids who are potentially, only have access to this one facility. So I think that, it's the standout point throughout, and I think it's the best tool that we developed to tell the story.
Yeah, no, that's great. That's great, Ashley. I appreciate that. So, Alex, can you, I guess, sort of building on that a little bit and some of the nuts and bolts of this, we use this term saturation rate and saturation levels. And can you dig into that a little bit more? Ashley talked a little bit about these ratios, but Alex, can you explain what those different sort of scenarios were and how we
Sure.
pulled that together?
Yeah, so our main saturation variable that we alluded to is really our compiled list of childcare programs. And that sounds easier than it really was. We pulled the data for childcare programs, and it was kind of a mixed bag based on addresses, based sometimes different longitude, latitudes, things like that. So what we did was we started by validating that information. We searched all of those facilities, made sure that the latitudes, longitudes matched, and then we geocoded all of those to make sure that they fit into a census tract. We had to identify what census tracts each one was in order to get a count of programs per census tract. So then as a result, we compile all the data, we did all the fun stuff, and we get to the number of programs, which is centers, homes, and ministries. Our team identified the census tracts for each of these programs and then the total count. And then we did a relationship between childcare and economic development, as I've mentioned. So the 5 pieces and the 5 ratios we developed were children under 5 per program, which looked at the age of children or the total number of children under 5 compared to the number of programs within each census tract. We looked at individuals earning less than 150% per program. So that's looking at individuals who are eligible for CCDF vouchers, fitting within a certain income bracket, level of poverty bracket, but focusing on, once again, that ratio of those individuals per program. We also looked at employment per program. So we looked at number of jobs. We looked at shift jobs, specifically in manufacturing and healthcare. And we did a ratio based on those 2 per program to get an idea of what employment looks like. And then lastly, we wanted to take a look at housing, right? Childcare, housing, economic development. We are learning and know that all 3 of these are mutually exclusive. They all are really related at this point in time. So we looked at housing units, we looked at housing permits, and that was per program as well, to get an idea of where housing is located, where childcare is located, and are they communicating? Are those systems working in tandem? Those kinds of things are what we're trying to evaluate here.
That's great. That's great. So Ashley, I would ask you, just in your opinion, which one of those variables did you find the most powerful? Which one did you really like?
I think that, the best place to start is with the simplest one, right? So we look at children in need of care, which even coming to what that number should look like is a little bit of a challenge, but it's very telling, right? And I think pairing that, especially with low income families or individuals, I think really, it gets you more than halfway there in telling that story. We want to know where the greatest demand is, right? Which is where there are children living, and who maybe is most likely to face the most significant challenges in accessing that care, right? Because it's not something that we really tackle with this, but I think this is in a lot of ways the first step towards, we look at the just where there's a childcare desert, right? But then the step after that, once we have an increased supply of childcare, is it affordable? Is it accessible, right? And that kind of starts to answer that question, or at least starts to look at who is most likely to face the most significant barriers in accessing childcare. If it's not in your area, that's one thing, but even if it's there, if you can't afford it, it might as well not be. Um, I think that, determining exactly where we set kind of the median in those ratios was also pretty challenging, right? Just because it's the middle, the median for the data set that we have doesn't mean that that's like where we want to set the median mark, right? So these, when you look at the maps, it goes from, green to yellow to red, right? And putting that yellow just arbitrarily right where the median exists in the data set was not always reflective of kind of where we think communities should aim for. But there's also not like a standardized number for like the number of childcare programs that should exist in a community, depending on the number of jobs. That doesn't. There's not a metric that we've all decided is accurate there. So that was a challenge, and it took a couple of iterations to find kind of what that sweet spot was, and then find it again for the three other places that we were using that saturation metric. But I think it comes out in a way that's consistent.
That's great. That's great. Ashley, I'm going to stick with you for this next one. Can you tell us a little bit about, obviously data, by the time you put it out there, it's sometimes dated almost or on the verge of being dated. So can you tell us a little bit about the process, the procedures we have in place and keeping this updated and how we make sure it stays fresh and relevant?
Yeah, so thinking about it in kind of two parts, we'll have two different schedules for updates. So the existing childcare facilities or programs, those will be updated monthly. And so like when you open it up, right now it's a little bit dated, but now that we're done, we have a regular system in place. So by the end of next week, you should see an update in on those dots on the map. So the number per, based on that census tract, right? Um, the kind of rest of the data will be done on an annual basis, because that's when the major public, data sources like the Bureau of Labor Statistics and the American Community Survey, that's when that data gets updated. So it won't be the exact same time, but shortly following those updates, you'll see the rest of it kind of go into the next wave.
No, that's great. Thanks, Ashley. I'm going to divert from our script here just for a moment. We do have a question in the chat. If we thought about developing programs to help and remove barriers for small business owners or entrepreneurs to create available, affordable, and accessible childcare centers. And I can kind of tackle that one. And I will say, yes, we have. It wasn't really part of this project per se with the data, but I would point to another one that's out there and it's public and it's readily available. The Invest Hamilton County. We did some work in Hamilton County. And this was really a big part of it, the strategic plan, the investment plan, and a lot of that focused specifically on what this economic development organization is sort of the convener, bringing this coalition together, what they can do to ease entry for potential entrepreneurs that want to enter the space, what they can do to sort of build capacity and then keep costs down. So some of the things, and again, just off the top of my head, you'd have to, I guess, look at the full report and we'll see if we can find that link for you too. But some of the things off the top of my head would be some of like the back end office stuff for these smaller entrepreneurs that might be just starting off. So could there be a coalition that handles payroll and taxes and withholdings that provides that for them? Curriculum is another one. We work with partners around the country that actually develop and sell like curriculum for early learning. So sort of open sourcing that, creating a resource hub so that you can make sure that folks that are providing even in-home care have access to high quality curriculum to make sure that children develop and everything is wonderful and to provide that high quality aspect of it. And then we've talked with employers as well. There's really some good examples of they've sort of pivoted somewhat with some of their employee assistance programs where they really have this sort of crowdsourcing where it's a hub where folks can come together and share resources and challenges. And even some employers have gone in the direction of actually using it as almost like a child care savings account, like a health savings account to help them with the money that they might need to really afford child care. So there's really a lot of different angles you can come at it from, and even from the economic development perspective, hoping with zoning, helping them to understand the regulations, the things they need to do to be compliant and site selection is a really valuable asset as well. So those are some of the examples, and it looks like, yep, Ashley's dropped the public link in there. So we're happy to maybe that'll be a topic of a future discussion for sure. So
I think I sent it to you directly, Brian. So
okay, all right,
I
that's
think
good.
because you're the host,
That's
you might be the only one able to send it out to
Oh
the
yeah, probably. Okay, let me do that. So let me So listen, we're wrapping up here because we are committed to the smart take, the quick take without all the fluff. So let me just hand it over back to Alex and just ask really one last question here. Alex, where do you see this going, buddy? What's the future of this type of work, either in general or perhaps for Northeast Indiana?
All right. So really for Northeast Indiana, I think the next step is to one, keep the data as updated as possible. I know that's such a big ask. That's the nature of the beast at this point, so to speak. It is a positive reinforcement to know that every month we will do childcare centers, facilities, ministries, all of that stuff, because everything is adherent to that. So keeping that data as valid is probably my number one recommendation. In terms of nationwide, childcare unfortunately remains an issue. We are seeing legislation slash costs and slash benefits for childcare workers, for families, for all sorts of things, unfortunately, in our state and in others. So my recommendation is to keep relationships strong, really to highlight what you were speaking about, Brian, is that in-kind relationship, trust development, especially for small communities. Develop those trusts and relationships so that even some of that is even possible, right? It's a tough one. Childcare is tough. We're learning that a lot of people need it and a lot of people can't afford it. And we're seeing a lot of innovation in around childcare, and that's really like good for the future of childcare, is that people are trying new things and successfully trying new things. So there is hope in a really tough one.
Yeah, that's great. That's great, Alex. I appreciate that. We like to end on a hopeful note for sure. So Ashley, I'll give you a chance to throw out one more hopeful note for everybody as well. As really the architect of a lot of the tech work here. What final takeaways might you have for everyone?
Yeah, I think what's really powerful about the Northeast Indiana Childcare Coalition is that it's not just thinking hyper locally, right? It's thinking about, addressing childcare on a more regional level. When you do that, we talk a lot about data driven decision making. But if you don't have that data collected and presented in a way that is accessible and understandable to both experts and organizations that maybe aren't super focused on the data aspect but need to be able to work off of it, if you don't have that, you can't make those kinds of decisions. So, I would love to see this kind of tool replicated um, e- everywhere it's possible, because it gives a lot of people who have great ideas and great intentions that additional tool in their toolbox to see those things to fruition and to aim those good ideas in the best way possible. Investors who want to support the improvement of childcare access but don't know where to do that, or even how to know where to do that. This provides that opportunity, both for advocacy and for direct action. So I'm hoping to see it expand.
That's great. Thank you, Ashley. So with that, this does conclude our smart take. I'm going to put my email in the chat. If anybody wants additional information, would like a follow-up conversation, and you probably want to talk to Alex or Ashley more than me, and I'm happy to facilitate that connection. But I am going to drop my email there, and I just want to thank everybody for attending today, and we look forward to seeing you on the next TPMA Smart Take. Take care.